Hi, hello everyone. Welcome to eyecareoptom. So today I'm going to discuss about Worth dot test. This is a clinical test to assess the binocular vision, including diplopia, suppression, and abnormal retinal correspondence. In this video, I'm going to cover about the introduction of the test, methods, interpretations, and indications for this test. A normal construction of Worth dot light usually contains 4 lights. In this, upper light will be in red in color, and the 2 side lights will be in green in color, and the bottom one will be in white in color. We have 2 types of Worth dot test. One is distance Worth dot test. It will be done at 6 meter, and the second one is near Worth dot test. It will be done at 33 centimeter. Method of this Worth dot test. This will be done in semi-dark room. Always it will be done with a refractive correction for distance and near accordingly. With habitual correction, add red filter to the right eye and green filter to the left eye. Instruct the patient to see through the both eyes and ask them not to squeeze their eyes. First, to check the right eye, cover the left eye of the patient. Ask them how many lights and what color they are seeing. We have placed a red in the right eye, so they will be seeing 2 red lights. To check the left eye, cover the right eye of the patient. Ask them how many lights and what color light they are seeing. We have placed a green filter in the left eye. They will be seeing 3 green lights. And finally, with both eyes open, ask the patient to see and ask them to describe what they see, including number of light, location of light, and color of lights. And we should ask them all the lights are constant or if some are coming and going. Interpretation of Worth dot test. Remember, the patient is wearing red in the right eye and green in the left eye. So the lens on the right blocks the green light and lens on the left blocks the red light. The right eye sees only the red and white lights at 12 and 6 o'clock position, and the left eye sees only the green and white lights at 3, 6 and 9 o'clock. That's why when we cover each eye separately, white light will appear red through the red lens and green through the green lens. When the images from the 2 eyes are superimposed, the white light may appear only as red or green depending on the ocular dominance, or may switch to red and green, or they can be in mixed of both the colors. First scenario, if the patient reports 4 lights, 1 red at the top and 2 green in the sides and 1 mixed color or orange color in bottom. This indicating normal, we can document as binocular single vision. Second scenario, if the patient is reporting 2 red lights, this means they are seeing through only right eye, then the left eye is suppressed, then we can document as left eye suppression. Third scenario, if the patient is reporting 3 green lights, this means they are seeing through only the left eye, then the right eye is suppressed, then we can document as right eye suppression. If the patient is reporting 2 lights and 3 green lights alternatively like coming and going, this means alternate suppression, then we can document as alternative suppression for both eyes. The patient is reporting 5 dots with 2 red in the right side and 3 green in the left side. This is an diplopia. Just check the right images are in the right side and the left images are in the left side. So this is not crossed. Then we can document as uncrossed diplopia. If the patient is reporting 5 dots with 2 red lights in the left side and 3 green lights in the right side, this is also an diplopia. This is an crossed diplopia. If the patient is reporting 5 dots with 2 red lights on the top and 3 green in the down, just remember upper eye will see the lower images. In this scenario, it will be vertical diplopia with right hypodeviation or left hyperdeviation. If the patient reports 5 dot with 2 red in the down and 3 green in the up, here this is vertical diplopia with right hyperdeviation or left hypodeviation. Indication of this test: in manifest strabismus in vertical or horizontal tropias like esotropia, exotropia, hypertropia, hypotropia, we can do this test. And in cases of diplopia, this test will help us to differentiate from crossed and uncrossed diplopia. In cases of suppression, this test will help us to identify which eye is suppressed.
Flick, clap, pull it.